Hi everyone, I'm Dr. Nonnie. I'm a GP, and my health channel, which I invite you to and I welcome you to today, is to make health accessible to everyone and for you to have health information that will make you aware and not scared. And today I'm going to be talking about a topic which is quite emotive for many, and that is access to a GP, or rather the lack thereof. Many patients call their GP and they hang on for ages, they can't get through, and they wonder what on earth are these GPs doing. And the GPs themselves are quite annoyed because they've been ordered back to see to work, as it were, in the latest article we read in the Telegraph, I think it was, where they were asked to go back to work as though they were not working already. And so to help us make light of this, and to understand this better, are these GPs skiving or are they really working? So I have with me an experienced GP. She's a partner, she's a philanthropist, she's also a businesswoman. So she understands this sort of things and she's going to help us shed light. She's my guest today, Dr. Pearl Onyekeru. Pearl, you're very welcome.
Thank you, everybody, and thank you, Dr. Nonnie, for inviting me. So thank you for having me this afternoon.
Good. So let me just take my glasses off because this is serious business, Pearl. We've got to dig into this. So as you know, I've been doing lots of out of hours now because since the accident which I had, I used to be regular at the surgery, GP surgery, in hours GP, and now I'm doing out of hours GP surgery work more, where I am seeing face-to-face patients, and I'm also triaging. And many patients will tell me, doctor, it's a nightmare to see my GP, because I'm wondering why you're presenting to me in out of hours with something that should be managed by your own GP that knows you well. So Dr. Pearl, explain, why can patients see their GP?
So thank you, Dr. Nonnie. That's a really important question, and it's a really important problem. We know that a lot of patients, have, raised concerns about the access to their GP. And for those of us who work in practice and work in hours, we are also concerned about the access and the ability to be able to serve the populations that we look after. Now, access, or the difficulty that people have, is multifactorial. There are many reasons why, access has changed. So in what's happened over the course of the pandemic is that we have been working, though what we haven't been doing is doing as much face-to-face as we've normally done prior. But the pandemic of its own has created a set of problems that did not exist before the pandemic. And that has, added to the pressure on general practice. And we know that even before COVID-19, general practice was under pressure anyway. And so now we've had an extra pressure. So there are several things that that have caused that pressure. So one is the fact that a lot of people have, we have been seeing patients, we've been dealing with complaints, we've been managing chronic problems, because all of those people still need to be seen, and we've been managing them remotely where need be. Sometimes they've had to come into the surgery where we can see them safely, because of course, that if one partner or one practitioner becomes unwell, that person has to self-isolate, and that then creates the lack of pressure, the increased pressure on the system, because then you're having to leave, you're losing staff. So that is part of the concerns that we've had. During the pandemic, one of the reasons why we couldn't open the doors fully is because we didn't have access to PPE. And, that was one of the main problems. A lot of the funding for PPE did not come to the GPs until much later. And in my practice, for example, we couldn't get face masks, we couldn't get shields, we couldn't get any, there was no guidance. And so, we could see what was happening in the hospital, and a lot of our colleagues, even a lot of our staff, were getting sick. And then we still had to be able to manage, to provide a service. So it has been a difficult time. And I can appreciate the fact that it's also been a difficult time for, for our patients as well. Now, one of the things that has happened, that's like I was mentioning, is that the pandemic itself has created an extra pressure. So a lot of patients, normally we would see one patient at a time with one problem. Of course, you'd always have those that would have more than one. But now, because people have they've kept, they've stacked their problems up. So when they're coming to see their doctor, they're not just coming with one problem, they're coming with 2, 3, 4, and these may be complex problems that cannot be dealt with in a 10-minute appointment. And if you're asking someone to come back over again because you have multiple problems to deal with, it seems as if they're being either pushed away or fobbed off. But I mean, even though we still do telephone appointments, we are still given 10 minutes per appointment, and that really doesn't give us the capacity to deal with the complexity of a lot of the problems we're seeing. In my practice as a GP, what the pandemic has thrown up has also been an increase in mental health concerns. And that is across the board. So it's not just in adults or older adults, but also in young children. The lack of integration, the lack of access, the lack of the isolation that a lot of children and young people have faced has also meant that, and we are seeing a huge cohort of patients that we wouldn't normally see in quite the same numbers coming forward with mental health concerns, and we're having to deal with them appropriately, signpost them appropriately, help support them as much as we can, and so that's created another level of pressure that wasn't as severe as it is right now.
I can stop you there. So it sounds to me like, just listening to you, I think you probably need a GP as well to sort out general practice, because you're just going on with a long list of problems. I hope the health secretary is listening, because these are real pressures. And I have to be honest, because I was working in general practice from the start of the pandemic, even before the pandemic. I was one of the ones that were calling for, let's do something, from January. So I was well aware it was going to be a problem. So I walked through it all, and I knew what the pressures you're describing are very real, and they are there. And basically, it's a case of we still have the same 10 minutes to deal with the patients. And because the patient is at home, they're bringing more than one problem to a 10-minute consultation. And obviously, due to the risk of affecting other patients, and also staff with COVID-19 virus, we have to have a limit on the numbers that can come in, because if the practice is closed, then obviously it means that there is no, the whole practice, with all the 8,000 or 10,000 or whatever this number of patients will be without a GP. So, okay, we get that. And obviously you didn't have PPE. I think we got PPE in Barnet quite early on. So I'm going to hold my hands up to say that we did get PPE early on. So I had that, and I did face-to-face as well in ours. But it was difficult, and the pressure is still on. I think, okay, we get it. More demand, less resources. They haven't put in more GPs. More GPs haven't magically grown from somewhere. And in fact, I think you've lost GPs, because obviously we've had a few colleagues who have died. We have a few like me who've left because of illness and not being able to, continue in that role. And so we've had that as well. I think what we should do, what I try to do in this channel, is to bring a little bit of positivity. Speak to number one. Let's do this in 2 segments. Speak to the patient who's trying to get through to their GP, who's really desperate, who doesn't need me. He doesn't need me, an out-of-hours GP who's only going to speak to them that Saturday or that Sunday or whatever. But they need some ongoing care. Like the lady who I had, whose daughter is not eating. She wants to be slim, and her BMI is normal. And she doesn't need me. She doesn't need me to come in and just, give him my spiel that day. She needs continuity. How do those people access their GP?
So thank you, Nonnie. That's, like you said, it's, what we're trying to do within general practice, and us, practitioners on the ground, is actually to look at the ways by which we can improve the ability of people. 2 things. One is to get access to the GP, and 2 is also to self-care, because there's a lot of work that can be done by patients at home that doesn't actually need a GP. And so we're trying to help people balance. And of course, one other thing that has come on board into general practice more than it had before, which is quite good, is the use of the 3rd sector, which is the voluntary sector. So, we're really looking at how best can patients be supported with their concerns, with their problems, in the best way possible. And whether that's by the GP, whether that's self-care, whether that's by voluntary sector, workers, or, your charities, so we're actually encouraging people to look, creatively about where they can go to get care that will suit them for what they need at that point. But coming back to GP access, generally, there are a couple of things that we have. So one thing is, in terms of general practice, now what has happened is that we have, we've always had the telephones, and I must say, in all honesty, a lot of telephone lines were not, at least for example, for my practice, was not built, or we didn't have the capacity that we need now, because it was never needed before, because majority of people would come to the front desk and book their appointment, and that was the bulk of it. And of course you had the telephone lines, so the telephones are still there, so you can still book an appointment on your telephone, by telephone. I know a lot of people can say, well, I've been holding on for 30 minutes or 20 minutes or whatever, and we appreciate that, and we're really looking at how we can improve our telephone access. So that is definitely one thing. Another thing that we have is some GP practices actually allow patients to self-book. So you can use a self-booking system whereby you can download your app and then you can book yourself into an appointment. So it's definitely looking at the technology available and seeing what's available in your own practice. Another thing that has also come on board, which wasn't there prior to COVID, is what we call the online consult. And the online consult is a system, it's an NHS-run system, which allows patients to put in their series of symptoms, and then that will generate a series of advice or take them down a protocol pathway that will then give them either advice as to how they can, either self-care or whether they need to see a GP. And so that's definitely one thing. And for us in my practice, when we have the online consult, we always respond to that, so you will always definitely, get some sort of feedback, whether that is an appointment booked or a telephone call, or, or even if we might ask if it's a lesion, we might ask you to send in pictures. So you will always have some form of contact back from there. Another way that patients can actually access their GP is via email. So, so you can, if you can actually email in and say, because not a lot, but part of the work we do is not just patient care, it's also responding to queries and concerns, helping people give advice. And so some of that doesn't actually need a face-to-face, and it doesn't need a telephone appointment, but, they can email in their concerns, and then we can respond to them best depending on how we feel that response would need to be. So whether we might then have a phone call and have a discussion about what the concerns have been raised, or if it needs to come in, then we can also book a safe face-to-face appointment. I know that within some areas, the 111 system does allow patients to book in to, so if you're phoning 111, it will then book you in directly into the GP where those GP slots are available. So there is access. I must say that, it's people actually looking at what, one is what they need, and two is how to get it. We've had things like the hot hubs, which have worked in different areas, whereby patients, especially during COVID, or those with COVID-like symptoms, can be seen safely, and that's that would normally be following some sort of consultation with your GP, which would usually be a telephone consultation, would sort of triage your symptoms, give some advice, and if there's a concern that person needs to be seen by a clinician, then we would then refer you to a hot hub where you could be seen in a safe space.
Let me summarize. So basically what you're saying depends on the practice. All practices offer different levels of this extra form of remote consulting, so to speak. So the traditional face-to-face is very patchy right now in general practice. I think that is a fair summary. Okay, you're more likely to be seen face-to-face by an out-of-hours GP than an in-hours GP. And I think that's, I have some patients who say to me, we just book with the out of hours NHS 111 because we know we're going to be seen. So people are now using NHS 111 instead of using their traditional GP. And that's because of the access to face-to-face. I think patients are used to face-to-face and they feel they need face-to-face. And from what you're saying, it doesn't always have to be face-to-face. You can send an email, you can do an e-consult, you can telephone, You can even text. So the GP is becoming more modern, folks. So you need to follow the times, 21st century and all that. So we hear you, Dr. Pearl. But obviously, there's another layer of this problem because at the end of the day, the problem is, as you say, general practice was creaking at the seams long before COVID. And COVID in itself has brought in the extra pressure of people being unwell and needing care, and also people being anxious and mentally unstable. And also, we have one of the videos I did earlier was about the lack of access to family and friends to support the new parents. So we're getting so many new parents coming in now. I mean, I had to do a video about that as well to support them. So we know that. Let us speak just in 2 sentences. Speak to the powers that be. So the NHS, providers, the leaders of primary care, because you're a GP partner, so you are one of the people in charge. Speak to those people and what advice from someone who's actually working on ground. You're not just one of the business people making decisions from Whitehall or whatever. You are actually on ground seeing patients. So speak to Matt Hancock, speak to any of the secretaries of state that are listening. What can they do, just in 2 nutshells, to improve things for everyone? Because the GPs are struggling; they feel unheard, and they feel hurt. So people are saying you're not working when you are working. So I get that because I mean, as I said, I was doing in-house GP. I had to work on Good Friday. I never did that before in my life, but I had to because there was a need for that. So speak to the powers that be that decide what happens in health and just give some advice as someone who's on the ground and who is a partner.
Thank you so much, Nonnie. Yeah, I think so. My voice to our health services would be 2 things. So there are 2 aspects of healthcare, and in general practice and primary care, we offer 2 main aspects of service. 1 or 3 main aspects of service. 1 is management of long-term conditions, treatment of acute conditions, and health promotion. So these are the main areas whereby these are the main areas in which general practice sit, and so all of these areas need work. So when it comes to long-term conditions, we need to be able to have support, not just for our GPs, but for all of our clinical practitioners who may be nurses, advanced nurse practitioners, ambulance staff who work, our pharmacists who work within general practice or work within primary care and social care, because we work alongside our social care colleagues. So a lot of them need a lot of support. We need a lot of training. We need the funding to follow the needs of the patient and the needs that are generated, even the hidden needs, because when people are looking for a place for an elderly relative, or they need extra OT support, that need is real and it's there, and we need the funding to be able to support that need so that people can get care in a timely fashion, and people can, we can develop the skill set that will enable people to feel confident to be able to provide those services across the board. So that's one aspect. Another aspect is for those of us who work in primary care and offer acute care. That means we see day-to-day patients with ongoing concerns. And for that particular, and that is really where the pressure is, where somebody calls up, I'm unwell today, I need help. And this is a real area of pressure for us as general practitioners. We need the skill, we have the skill, but we don't have other numbers. So we don't have the numbers to support the need that is there. We work alongside a lot of our, healthcare professionals who are, who may be, in their own skill sets, and we need extra funding, but we need increased numbers of such people to come through, because it does take a long time to become a confident GP, and it does take a long time to become a confident nurse prescriber. So we need the government to work with primary care commissioning to be able to increase the numbers. We've had patients, some of our staff who have come in and they, look at the workload and they think, oh God, I didn't know that this was their pressure, and they leave because it's outside their comfort zone. There's not work that they've done before. And, and so we need ongoing training. We need the funding to allow people to be trained competently, trained quickly, and, and the funding to make the work, to people feel worthwhile with the amount of work they do and the amount of risk that they take to look after people safely.
Yeah, I think that's a very good point. And I mean, I think I'm not going to re-echo what you said. I mean, you said it well. We just need more people on the ground. You need to have be valued when you're doing the work. Otherwise, people do not stay. And we also need to be safe at work. You've got to feel that you're safe. So if you're listening, at Hancock and Dr. Datani and all the other people who are in charge of primary care, please, just meet with GPs who are on the ground and then see how we can all work. Because we're all in this together. We've all seen that this COVID-19 was a health pandemic and the health system wasn't prepared. Let's just be honest, they wasn't prepared to cope, and many things have come out of COVID. So going forward, as we are rebuilding and we're reflecting and doing all the dissection of what happened and what could have happened, let's remember to build up primary care so that I always tell my medical students, I don't know where you're going to end up, but many of you will end up in primary care. And so we've got to make sure that primary care is built up as a good resource to cope with, because we see the most of the patients in the country. And so we're going to leave it now. Like good GPs, we've overrun as usual, because GP practice, anytime we have a 10-minute appointment, because the patient's problems are so many, we always overrun. So we've done that in typical GP style, overrun. But I'm going to leave the last minute or two to Pearl to tell us quickly about what she does to distress from all this stressful work that she does in the NHS.
Oh, thank you, Nonnie, and thank you. Yeah, so for those of us who work within primary care, it has been a really stressful time, for all sorts of reasons. And what I found, I was really affected by the COVID pandemic, and I had anxiety myself, and that's true. And I was, I had to look at ways of managing the fact that I still need to go to work. I need to be able to bring my skills to the table to support my patients, but find a way to manage my stress. And so what I do, or what I found to do was, so I run a small business. I'm a small beauty consultant with Mary Kay, and it's just been a way to, like I always say, to have different conversations with women, to reach out, to have a community of friends and women, who would benefit from looking beautiful, feeling good, and just elevating your spirits in a way that is different from from the health space. And but that's been a real blessing for me, is to be able to reach out to women with my small business as a Mary Kay consultant.
Wow, so well done. I mean, you heard it here, beauty and brains in one. Well done, Dr. Pearl. So we're going to wrap it up now, and I'm sure Dr. Pearl won't mind you consulting with her to get some beauty advice. I've gone to see her myself. She sold me a few products. So, I hope I'm looking beautiful enough for you today, Mary Kay.
You're looking gorgeous.
So we're going to put her link to her page in the chat, as we normally do, just to support her, to give her something to distress from all the hard work she's doing. She's also doing the COVID vaccination clinic. She's been on the front line guiding people as well. So she's been really busy, and I know that for sure. So I'm just going to round up by saying thank you all for watching. Do like, share, and subscribe. And I love the comments. A lot of people get back to me and tell me yes or no, as the case may be. And I know that only 5% subscribe. So if you are really enjoying this, it's a real blessing for me, because this is my way of distressing, is just to go out there. I love to teach, I love to impart information. This is my way of distressing. So let's support Mary Kay and support with Pearl, and support me as well. And like, share, and subscribe our video. Thank you very much.
Thank you so much, Nonnie. Thank you, Dr. Nonnie. It's been an absolute pleasure. Thank you.
You're welcome. Thanks for coming on.